I am Professor Ernesto Leal-Junior, the head of Laboratory of Phototherapy in Sports and Exercise at Nove de Juhlo University, and I am also the research leader of Multi Radiance Medical. We will talk about Photobiomodulation Therapy and/or cryotherapy for exercise restitution. What is better? It's widely known that several different modalities are used aiming to accelerate restitution after exercise. However, there is a limited scientific evidence behind the use of these modalities. Specifically about cryotherapy, despite this is one of the most used modalities, the scientific evidence for the use of this modality is extremely limited. On the other hand, photobiomodulation is a novel therapy that has demonstrated high efficacy in order to accelerate exercise restitution. So, with this aim in mind, we performed this randomized clinical trial, where we tried to analyze the combined and the isolated effects of cryotherapy and photobiomodulation in order to accelerate exercise recovery. 50 male volunteers were recruited, and they were treated immediately after an eccentric exercise with photobiomodulation or with cryotherapy used as isolated or used as combined therapies. We did assessments related to strength, related to delayed onset muscle soreness, and related with muscle damage as well. For photobiomodulation therapy, we used the portable superpulsed game day laser. Our outcomes demonstrated that photobiomodulation was able to enhance strength of these volunteers and also to decrease pain and decrease muscle damage after an eccentric exercise session. When cryotherapy was applied before photobiomodulation, the results was very similar to placebo treatment group. At the same way, cryotherapy used alone as a single treatment was not better than placebo treatment. Our outcomes indicate that photobiomodulation used as isolated therapy was the best therapy in order to accelerate restitution of volunteers after an eccentric exercise session. If cryotherapy used immediately after photobiomodulation, the outcomes are decreased. However, they are still better than placebo treatment. On the other hand, cryotherapy used as single treatment or cryotherapy followed by photobiomodulation wasn't better than placebo. This means that if you apply cryotherapy before a photobiomodulation treatment, the cryotherapy treatment will basically neutralize the effects of photobiomodulation. If cryotherapy is applied after photobiomodulation, cryotherapy will slightly decrease the effects of photobiomodulation. So the key point here is, if you want a better restitution, use photobiomodulation as single treatment. This is better than 20 minutes of cryotherapy.